There are a lot of genetic, dietary, and behavioral risk factors leading to hypertension. In today's episode, we'll take a look at whether environmental factors can also contribute to higher blood pressure and how this might happen. Hypertension or high blood pressure is one of the biggest symptoms and also cause for many diseases. Blood pressure is considered normal if it remains below 120 millimeters of mercury during systole or maximum contraction, and 80 millimeters of mercury during diastole, or maximum relaxation. Of course, this can change during exercise and over the course of the day. So when we are taking blood pressure at home, it is best to take it while relaxed and at a consistent time of day, along with taking several measures. If blood pressure is too high, it can place excess strain on our blood vessels and in our organs, causing long-term damage. At its most severe, the overly high pressure can cause blood vessels to burst, leading to heart attacks and strokes. Recently, scientists and physicians are starting to consider the impact of the environment as potential risk factors for hypertension. One of the first major ones we'll look at is temperature, with most studies suggesting that cold temperatures cause an increase in our sympathetic nervous system. In turn, a common response to higher sympathetic activity is a narrowing of blood vessels. So as a result, blood is flowing through a narrower tube, resulting in higher blood pressure. In contrast, blood vessels generally open up wider when it is hot, and blood pressure is generally lower the warmer the temperature. However, heat is not always a good thing, as high daytime temperatures may lead to higher nighttime blood pressures due to dehydration and disrupted sleep. Another interesting risk factor for hypertension may be living at higher latitudes, especially so in the northern hemisphere. Why might this be? Some ideas include that these regions are generally colder than the regions around the equator. There are also different patterns in the amount of sunlight and vitamin D production that may play a role. Finally, our evolutionary adaptation from our tropical origins towards salt and water retention in the face of high sweat rates may not serve us as well in modern society in northern climates with less sweating and more dietary salt availability. Along with latitudes, living at higher altitudes has also been associated with increased hypertension risk. This is likely due to it being colder as you go up in altitude and also the increased sympathetic nervous system activity. Also, a common response at higher altitudes is an increased amount of red blood cell concentration, which makes our blood thicker and therefore requires higher pressure to pump even without any changes to our blood vessels. Pollution and secondhand smoke can also contribute to hypertension. Pollution can increase sympathetic nervous system activity. Pollution can also cause inflammation both within the blood vessels and also different organs, impairing blood flow and potentially causing long-term damage. This is certainly the case with smoking and secondhand smoke, which directly damages the endothelium or blood vessel walls, making them less elastic and less responsive to blood pressure changes. Finally, another environmental contributor to hypertension may be living in a very noisy area, such as near heavy traffic or airports. That noise can acutely increase stress and sympathetic activity and can also cause long-term hypertension and cardiovascular damage through disrupted sleep. I hope this episode gives you a taste of how far-reaching the impact our environment has on our physiology and our health. I'm Professor Stephen Chung, and I run the Environmental Ergonomics Lab at Brock University in Canada. We post new episodes on different topics in environmental physiology every Wednesday. Thanks for watching. See you next time.